Dr. Ksenia Novak do just 2 examinations to understand the condition of your digestive tract. Watch this video to the end, and at the end I will give 3 tips on how to keep the gastrointestinal tract in ideal condition. Who absolutely needs to undergo an examination of the gastrointestinal tract? First of all, those who really have obvious symptoms of its impairment. These include flatulence, bloating, constipation, diarrhea, pain in the abdomen of various localizations, the presence of allergic diseases, allergic skin diseases, pollinosis, and even bronchial asthma, as well as general skin problems such as acne, pimples, blackheads, psoriasis, or other skin issues. If you have fibroids, mastopathy, or endometriosis, this is also a reason to consult a gastroenterologist in order to examine your gastrointestinal tract. Problems with weight and metabolic diseases can also be a consequence of an unhealthy gastrointestinal tract. Various deficiencies of vitamins and minerals are common, and very often people with an affected gastrointestinal tract complain that they cannot raise their vitamin D levels or that they constantly have low iron levels and cannot increase them. In such cases, most likely you need to see a doctor. If you have elevated cholesterol levels, this can also indicate problems with the liver, bile flow, and intestinal excretion. Frequent colds, exacerbations of chronic viral infections, low immunity, and autoimmune diseases are also indications. Age over 40 is also an indication for examining the digestive tract, because after 40 the risks of oncological diseases increase. And it is easier to prevent and carry out prophylaxis than to treat them later. How can we assess the work of our digestive tract at home? Of course, by evaluating our stool. First of all, we pay attention to the frequency of bowel movements. If you have constipation and constipation is less than once a day, then most likely there are problems, and further examination of the quantity and quality of stool will be necessary. We recorded a separate video on this topic, which I recommend you watch, so we will not dwell on this point here. Another important point is discomfort. Before or during bowel movements. If you feel spasms and abdominal pain before going to the toilet, this is a sign of a condition such as irritable bowel syndrome, and additional examination will be required. If you have pain during bowel movements, this may indicate hemorrhoids or a fissure. Another symptom is pain syndrome. Abdominal pain can indicate not only involvement of the digestive tract but also other organs, such as the kidneys or the reproductive system. Here we assess localization, when the pain occurs, and its intensity. The pain can be located anywhere. If we suspect the digestive tract, it is most often in the upper abdomen, which may indicate problems with the stomach or duodenum. Pain in the right hypochondrium most often indicates problems with the bile ducts or gallbladder. The gallbladder may be sluggish and distended, causing dull, aching pain, or in the case of hyperspasm, the pain may be sharper. There is also a dangerous disease such as appendicitis, an acute surgical condition. It also manifests as abdominal pain and begins in an interesting way. With appendicitis, pain starts in the epigastrium and after several hours moves to the lower left area, localizing in the iliac region and increasing. If pain moves from one localization to another in this way, it is necessary to urgently seek medical help as it may be appendicitis. There are also so-called dagger pains, which are very severe and unbearable, forcing a person to assume the fetal position, curled up on their side, which brings some relief. Such pains occur with peptic ulcer disease and acute pancreatitis. These are very serious conditions that can lead to severe consequences. Therefore, if there are intense unbearable pains in the upper abdomen, especially if they radiate to the back, it is necessary to call an ambulance or go to the emergency department, as this may be an exacerbation of peptic ulcer disease or acute pancreatitis requiring urgent medical intervention. In addition to gastrointestinal problems, abdominal pain can occur with renal colic, when kidney stones pass and become lodged in the ureter, causing spasmodic pain. With pyelonephritis, pain can also be in the abdomen, but more often it radiates to the back. Diseases of the reproductive system, especially in women, such as inflammation of the adnexa, ovaries, and fallopian tubes, can also cause abdominal pain, usually localized in the lower abdomen and sometimes mimicking appendicitis, which requires differentiation. Another important point is that abdominal pain can be an atypical manifestation of myocardial infarction. If abdominal pain occurs in an older person with a cardiac history, hypertension, or coronary heart disease, the first thing to consider is whether this could be an atypical form of myocardial infarction. Now we have reviewed the symptoms and manifestations by which you can independently assess and understand whether the issue is the intestines, the stomach, or other organs of the abdominal cavity. But how can we more accurately confirm that the problem is truly in the gastrointestinal tract? Here I highlight two main examinations that will help us determine this and outline a further examination plan. The first is a coprogram. A coprogram is a general stool analysis. It is done in a regular clinic and can even be done for free, or if paid, it costs a small amount, around 500 rubles. It includes more than 30 parameters and can show changes and pathological features at different stages of digestion, from the stomach to the large intestine. We can assess the function of the stomach, gallbladder, pancreas, small and large intestines, and even determine the presence of fissures or hemorrhoids based on a symptom, such as blood in the stool. Few people know how to properly prepare for this test, so I would like to explain the rules. To assess the work of the digestive tract and the digestion process, it is necessary to eat everything for 3 days: meat, fats, vegetables, fruits, and grains. If you are on a specific diet, for example vegetarian, unfortunately we will not be able to assess protein digestion if you do not consume animal protein. To evaluate the digestion of all nutrients, proteins, fats, carbohydrates, and fiber, they must come from food. It is also necessary to exclude foods that can color the stool, such as beets and prunes, as well as medications that can change stool color, such as iron or bismuth preparations. Stool should be natural, without the use of enemas or petroleum jelly. You should collect the material yourself after a natural bowel movement. Samples should be taken from 5 different points, not just one. The material should be delivered to the laboratory within 10–12 hours. Ideally, it should be a morning stool sample delivered while still warm. If this is not possible, collect it at another time and store it on the refrigerator door to slow bacterial growth and prevent distortion of results. For women, a separate rule is not to collect material during menstruation to avoid blood contamination that could distort the results. Another examination that I consider a standard screening test is an ultrasound of the abdominal organs, specifically with a test breakfast. I will explain what this is and why we need it. Ultrasound allows us to see the structure and size of the liver, the condition of the gallbladder and bile ducts, and the pancreas. We can even partially see the stomach and intestinal loops. Often, ultrasound reports mention diffuse changes in the liver, which usually indicate the early stages of fatty hepatosis, or less commonly, hepatitis. Fatty hepatosis is more common, especially if there is excess weight or visceral obesity. We can also assess the gallbladder, identifying deformities or congenital anomalies such as a duplicated gallbladder, kinks, or constrictions. We may see heterogeneous contents, such as sludge, stones, or polyps, which also indicate gastrointestinal problems requiring further examination. When we see constrictions or adhesions, they may be anatomical or functional. To differentiate this, the ultrasound should be repeated in a different position. If the constriction disappears in a vertical position, it is functional and indicates an overdistended, sluggish gallbladder, most likely hypokinetic biliary dyskinesia. If it does not disappear, it is an anatomical feature that may cause bile flow problems and require lifestyle and treatment recommendations. We can also assess the pancreas. Diffuse changes in the pancreas usually indicate chronic, low-grade pancreatitis. Ultrasound may also show bloated intestinal loops, indicating excessive gas formation, microbiota imbalance, or functional or anatomical obstacles to normal gas evacuation. These findings help us plan further strategy, whether additional examinations or treatment recommendations. I mentioned that this is not just a standard ultrasound but one with a test breakfast. A test breakfast simulates food intake using products that stimulate bile flow. Fatty foods stimulate gallbladder contraction, so the test breakfast must contain fats, such as 2 eggs, 100 grams of sour cream, coffee, or a combination. First, a fasting ultrasound is performed, then you consume the test breakfast, wait 40–50 minutes calmly, and a repeat ultrasound is done to assess gallbladder contraction. Normally, the gallbladder should contract by 65–70. Less than this indicates a sluggish gallbladder and hypometer dyskinesia, while contraction above 70–90 indicates hypermeter dyskinesia. This information helps guide further treatment strategy. This is a very important examination that is often underused or unknown. I have written a detailed post on how to prepare for this ultrasound on my Telegram channel, and I left the link in the description. Finally, 3 tips on how to keep your digestive tract in ideal condition. The first tip is to chew. The modern pace of life forces us to eat quickly while consuming information from gadgets, often eating on the go and not chewing properly. Digestion begins in the head, as signals to produce digestive juices originate in the brain. If you eat in stress and haste, your body is not prepared, leading to digestive problems, microbiota imbalance, and inflammatory processes such as gastritis, duodenitis, cholecystitis, and gallstones. Make it a rule to chew each bite at least 10 to 15 times and spend 15–20 minutes eating mindfully. The second tip is not to drink coffee on an empty stomach. Coffee contains aggressive acids that can provoke inflammation of the gastric mucosa, especially since most people have undiagnosed gastrointestinal issues. If you do drink coffee on an empty stomach, at least choose cappuccino or latte, as milk or cream reduces irritation, but it is better to drink coffee after meals and avoid smoking with it. Coffee on an empty stomach combined with cigarettes is one of the most harmful combinations for your stomach. The third tip is to drink enough water and eat enough fiber-rich foods such as vegetables and berries. Water is necessary for good bile quality and prevention of constipation, while fiber supports microbiota, intestinal motility, and evacuation function. I remind you once again that I prepared a post on my Telegram channel about preparing for an abdominal ultrasound with a test breakfast. The link is in the description. Subscribe to the channel, like the video, and be sure to watch it. Yeah,